بسم الله الرحمن الرحيم وعلى بركة الله نكمل محاضرتنا لهذا اليوم التي تتعلق بالهيماتولوجيكال investigation. في المحاضرة السابقة have some review what we have mentioned before. في المحاضرة السابقة اتكلمنا what are the indications which are required in order to make a hematological investigation, and we have an idea about the complete blood picture. And when we are going to use this type of test, when there is screening for a wide range of condition of a disease, when in order to evaluating the general health status, also if the patient is taking a different modality of a treatment, we need in order to maintain type of treatment, we need to maintain those types of patients who are taking chemotherapy or radiotherapy or any other types of medication. Also, we need these types of a treatment in order to evaluating the patient who is taking anticoagulant types of medication, like for example, the warfarin, the heparin, and so on. And we go further regarding the complete blood pictures, and we have investigating different elements. We have investigating the MCV, the MCSC, the MCSC, and the platelet number. In addition, we have an idea about the red cell distribution width and other element, like for example, the platelet counts. And we have more than that, and we go depth more than that in order to have an idea whether each types of element is going to be increase or decrease, and what are the specific causes. And we have an idea also about the white BC, whether the total white BC or the the neutrophil, the eosinophil, the basophil. And we have many systemic diseases which is going to be influenced directly or indirectly on these types of blood element. And at the beginning we have also idea about the white BC, and we say that in a level when it is going to be decreased, this may give us indication that this patient is complaining from leukopenia, or sometimes a patient may complaining from bone marrow disorder or bone marrow damage. In addition, the patient may complaining from autoimmune disease. Further also, other information we have been get that if the patient is complaining from increase in the level of the white BC, this may give me indication that the patient may have leukocytosis, and we investigated the different causes of the leukocytosis, whether it was a viral inflammation, leukemia, or any other allergic disorder. Furthermore, we have an idea about the neutrophil, and we say that increase in the level of the neutrophil may give me indication that the patient may have neutrophilia. And the trauma, the heart attack, or burns, or certain leukemia, like for example, the chronic myeloid leukemia, may associate it with increase in the level of the neutrophil, while decrease in the neutrophil may give me indication that the patient is complaining from neutropenia. And we have been investigating the different causes of that, whether it was a chemotherapy or a radiotherapy, or sometimes there will be a bone marrow damage. In addition, the cancer sometimes may be separate for the bone marrow. Another element that we have been investigating before، هذه كلها مراجعة للمحاضرة السابقة أرجو أن تنتبهون عنها، إنه lymphocyte. And we say that if the patient is complaining from decrease in the lymphocyte, this may give me indication that the patient have lymphocytopenia, or sometimes increase. And this may give me indication that the patient may have lymphocytosis, which is mostly associated with viral infection, like for example, the Epstein-Barr virus, or the toxoplasmosis, or chronic inflammatory disorder. Again, we're investigating the monocyte, the eosinophil, which may have a related to the allergy, like for example, the high fever, or sometimes a drug interaction, or parasite infection also. The basophil have been investigating by us in addition to the MCH, as I mentioned before, which is going to reflect small red blood cell and have a lower value in a case when the MCH is going to be decreased. Also, we have investigating the MCHC, and we have say also that this level is going to be increased value, and the patient may complaining from hyperchromia, and mostly going to be seen in hemolytic anemia, autoimmune disease, bone marrow, or spherocytosis. And sometimes a rare congenital disorder may going to be affecting the level. Furthermore, we have investigating the level of the platelet. هذه مراجعة بسيطة إلى المحاضرة السابقة اللي تكلمنا عليها، واللي تعتبر هي basic principles بالهيماتولوجي، واللي كان الغرض من عندها أثناء التعامل بهذا الموضوع أنه يعرف طبيب الأسنان المتخرج حديثا وحتى إذا كان متخرج من قديم الزمان when he is going to see any laboratory investigation, when he is going to see any laboratory result or hematological investigation, how he is going to direct it his mind toward the cause of that. لما راح يشوف زيادة أو نقصان بأي of the blood element that I have mentioned before, how he is going to deal with these types of patient and what are the most common or what are the serious condition that may associating with the above condition. الآن بعد أن تعرفنا على هذه element of the blood وتعرفنا ماذا تعني زيادة ونقصان every element، الآن راح ندخل to study the different types or the types of anemia which the dentist may have faced during conducting his dental treatment. So today we are going to start with the iron deficiency anemia. I choose these types of anemia because it is considered to be the most common types of anemia. And here, iron, which is considered to be as a major complement of the hemoglobin and essential for its action, it is going to be affected. We have to concentrating on this important subject. First of all, the iron deficiency anemia, it could be just a simple condition, and it may occur in a young woman in which they have lose blood each month through the normal menstruation without any major symptoms. This loss of blood, sometimes it's going small or temporary, but what I want to focus on by this lecture, the iron deficiency anemia, sometimes it is considered to be as a serious condition, and it is going to be required further investigation because continue oozing or continue bleeding from the GIT, sometimes it is going to be reflect a serious condition, like for example, the colon cancer, stomach ulcer or stomach cancer. Sometimes it is considered to be tumor or due to use specific types of medication. Like for example, the aspirin, the morphine. Therefore, slow and chronic oozing of this ulcer may lead to loss of iron. And as a result, iron deficiency anemia is going to be represented. So, as a general talking, iron deficiency anemia, it is representative a serious condition, or it is just refer simple causing the menstrual cycle. Other types of anemia, what I need to be investigated, I need to study what we call it the pernicious anemia. Here, in this condition, the body cannot make enough healthy red blood cell because there will be no enough vitamin B12. Those types of patients who is complaining from pernicious anemia do not have enough vitamin B12 due to the lack of the intrinsic factors. What we mean by intrinsic factors? This intrinsic factor is considered to be as a protein. The protein is usually made inside the stomach, and this may lead to the microcytic type of anemia, and sometimes vitamin B12 along with the folate is involved in making the hemimolecules, and this is integral part of the hemoglobin. So those types of patients may complain from lack of the intrinsic factors, which is responsible about the absorption of vitamin B12. Folate deficiency can be cause of anemia also, and this may occur due to the inadequate absorption. Also, long-term or heavy alcoholism patients or other condition may also affect the level of the vitamin B12 and may lead to the vitamin B12 deficiency. So here we could summarize the common causes of the pernicious anemia, as we are going to see. Lack of the intrinsic factor, which is considered to be the most common causes of the pernicious anemia. Here the patient cannot absorb adequate amount of vitamin B12. And sometimes wrong bacteria is going to be representing inside the small intestine. Either medication may lead to pernicious anemia. And if you are going to investigating those types of patients after taking history from them, we could see that those types of patients may have a history of surgical removal of part of a small intestine. P1 infection could be associated also. In addition, if we want investigating those types of patients, we could see that those types of patients may are strictly vegetarian. They do not take adequate vitamin supplement, or sometimes the consumption of grain, leafy vegetables. Again, chronic alcoholic or taking a lot of amount, consuming a lot of alcohol may affect the vitamin B12 also. أعيد بصورة مختصرة. تكلمنا على الايرون deficiency anemia. عرفنا what are the causes. وقلنا sometimes it is considered to be as a serious. And those types of patients may complain from loss of blood, or sometimes from the GIT. Sometimes the colon cancer or stomach cancer could be the cause, or even it is considered to be just a simple cause due to the menstrual cycles. Other types of anemia, what we call the pernicious anemia. Here there will be inadequate amount or lack of the intrinsic factors which is responsible about the absorption of vitamin B12 deficiency. Mostly occur in a patient who have been making surgical operation to the small intestine, or sometimes if you are going to investigating those types of patients, we could see that they are vegetarians or do not consuming or consuming a lot of amount of greeny or leafy vegetables, or they are alcoholic patient. So as a general talking, what are the signs or symptoms of anemia? Those types of patients may complaining from fatigue, dizziness. The most important things, those types of patients may complaining from neurological problems, such as confusion, dementia, depression, and memory loss. In addition, the symptoms in the digestive tract, including nausea, vomiting, heartburn, abdominal bloating and gas, diarrhea, loss of appetite. Again, hepatomegaly or enlargement of the liver. Sometimes those types of patients may have an oral manifestation, like for example, smooth beefy tongue. And if you are going to investigating those types of patients who have vitamin B12, we could see that there is abnormal or unusual types of movement. And this may relate it to the neurological causes. Those types of patients may have a tremor also. Actually, treatment of pernicious anemia is going to be occur by replacing the missing vitamin B12 in the body. This diagram may give us information about the anemia. Look, the RBC, the patient who is considered to be normal, the amount. Look, less amount of RBC and the white BC, how it is going to be representing in a patient with anemic. Again, The symptoms like, for example, fatigue, irregular heartbeat, chest pain, shortness of a breath, in addition to the pale or yellow skin, headache, and another manifestation that I have been say before. Other types of anemia which is considered to be as a serious condition, more than the iron deficiency anemia, more than the pernicious anemia. It's a blood disorder in which the bone marrow doesn't make enough new blood cells. And here the patient may complaining from heart failure, infection, bleeding, erythemia. As a result, a large of the heart is going to be occur. Again, a plastic anemia, it may reflect a serious condition. Sometimes it can develop suddenly or slowly, but it is going to be get more worse within time. Therefore, investigating the exact cause of a plastic anemia, which is going to be affected the bone marrow, is very important in order to be treated. Anyhow, if we want to investigating the exact cause of a plastic anemia, sometimes a number of acquired disease condition may lead to that. For example, the toxic, arsenic, and we could see in those types of patients who work a chemical substance with a chemical substance, like for example benzene also. Again, if we are investigating those types of patients, we could see that those types of patients under chemotherapy or radiotherapy, or sometimes they are taking a specific types of medication which may lead to that. Look at the viral disease, for example, hepatitis, the Epstein-Barr virus, cytomegalovirus, HIV, provirus may lead to the plastic anemia also. Sometimes autoimmune disease may play a role, like for example, the SLE, systemic lupus erythematosus, and the rheumatoid arthritis could be initiating this condition. This is considered to be as an acquired diseases or acquired causes. Sometimes there will be inherited condition. Fanconi types of anemia, which is rare types of anemia, mostly occur in female, could be to this condition also. Another types of anemia which is need to be investigating, what we call it the hemolytic anemia. This condition in which the RBC are destroyed and removed for the bloodstream before they are normal in life span is up. And there are a number of disease and conditions and a number of factors which is cause the body to destroy this blood cell. إذن هناك تحلل في الكريات الدم الحمر، وهناك الكثير من الأسباب التي تؤدي إلى تحلل كريات الدم الحمر، وبالتالي do not have a normal life span. So what are the causes of that? Again, as I mentioned regarding the pernicious anemia, some of these causes is considered to be as inherited. Some of them it is considered to be as an acquired. Inherited, sickle cell anemia, thalassemia, phagocytosis, glucosylphosphate dehydrogenase, pyruvate kinase deficiency. Acquired like hemolytic anemia, including autoimmune hemolytic anemia, drug or medication sometimes may lead to hemolytic anemia. Therefore, as a general talking, what I want to focus, investigating the types of medication that is taken by the patient is merely its effect on the hematological result. For please, before you are going to apply any dental treatment to those types of patients, please try to investigating whether the patient is taking medication before. يعني أنا اللي أريده من هذا الكلام, please try to focus on the systemic, try to focus on the hematology before you are going to apply any dental types of a treatment to the patient. Before you are asking about the dental treatment, try to investigating the systemic causes, try to investigating the type of medication, try to investigate this, what's the patient history before you are going to apply your dental treatment, because if you do not know that the patient is taking, for example, drugs or medication, you may face a great crisis during managing these types of patients. So let's go back. Sometimes the patient may have a mechanical hemolytic anemia, and certain infection may cause damage to the RBC, which led to the hemolytic anemia. Another inherited blood disorder, which is called thalassemia. Here, the body is going to make a few healthy red blood cells and less hemoglobin inside it. بصورة عامة, we have two types of thalassemia. عندي الألفا ثلاسيميا وعندي البيتا ثلاسيميا. يعني عندي الماينر ثلاسيميا وعندي الميجر ثلاسيميا. بالماينر ثلاسيميا, those types of patients usually do not have any manifestation. They are conducting their own life within normal. While the most common problem is related to those types of patients who have major thalassemia. The most severe form of alpha thalassemia is known as alpha thalassemia major or hydrops fetals. Severe form of beta thalassemia is known as thalassemia major or Colles anemia. This condition is going to be diagnosed early in the childhood. And the hemoglobin in the RBC have two kinds of protein. هي الألفا globin والبيتا globin. If the body does not make enough of this protein chain, red blood cell don't form properly and cannot carry adequate amount of oxygen. طبعا لدينا الكثير من البيشنت والثلاسيميا بالعراق. هناك مراكز للثلاسيميا موجودة في العاصمة بغداد وفي جميع المحافظات. They are dealing with the cases of thalassemia, and they are specifically in the blood transfusion for those types of patients. And as a result, those types of patients may occur due to the gene control, and here the body makes hemoglobin protein chain. When this chain is missing or alterated, as I say before, thalassemia is going to be occur. Actually, it is considered to be, as I say before, inherited disorder. And those types of patients may get abnormal hemoglobin gene from one parent but normal gene from the other carrier. إذن يحتاج إلى جين واحد in order to establish this disease. What are the symptoms of thalassemia? And the symptom of thalassemia is mostly occur due to lack of adequate amount of oxygen in the blood. This may occur because the body does not have enough healthy red blood cell and hemoglobin. So mostly people who have alpha or beta thalassemia can have a mildly anemia. People with beta thalassemia intermediate have a mild moderate anemia. انتبه على هاي النقطة. الألفا or beta thalassemia can have mild anemia. البيتا thalassemia intermediate mild moderate anemia, and وأكثر شيء يكون moderate types of anemia. So as a general talking, if you want to investigating the manifestation of those types of patients, the patient may have a slowly in growth, they are delayed in puberty, bone problems, hepatomegaly and splenomegaly. And some of these complications may relate to the types of treatment due to the blood transfusion from time to time. People with a beta thalassemia major have severely thalassemia. And as a general talking, the symptoms occur within the first 2 years of life and include severe anemia and other serious health problems. Those types of patients may have a pale, restless appearance. Actually, they are complaining from poorly appetite. If we go depths further, we could see that they are complaining from dark urea, slowly growth and the low in the puberty and specify the hormonal is going to be affected. Jaundice and enlarge of the spleen, that is to say, the hepatomegaly and the splenomegaly. In addition, the bone problems which may occur on the mandible, on the maxilla also, we could demonstrating that if we are going to take an X-ray for those types of patients, as we are going to see in our seminars, we could detect many bony deformity in those types of patients. Therefore, care should be taken when we are going to deal with them, specifically if we want to make any surgical operation. As we see, the RBC in a normal, how it is going to be represented. Look, the malformed RBC, how it is going to be representing in a major thalassemia. لاحظ كيف تكون هنا ال RBC structures مالتها. Then look the structures or malformed of the RBC in a thalassemic patient. Other types of anemia which is need to be investigated, what we call the skill cell anemia. Skill cell anemia is considered to be as a serious disease in which the body makes skill-shaped C-shaped RBC. بالحالة الطبيعية النورمال ريد بلاد سيل يكون على شكل disc shape. When it is going to be representing in a disc shape, it is going to be moved easily through the blood vessels. While skill shape contain abnormal hemoglobin that cause the cells to have a skill shape and do not move easily through the blood vessels. They are going to be sticky and as a result of a sticky, they are going to form clamps and get stuck inside the blood vessels. Look how we are going to investigating these causes the later, but as a general talking, skill cell anemia. Here, the red blood cell is not going to be formed within a normal structure. The normal structure is going to be here, pass the RBC through the blood vessels, but it is going to be formed and within the C shape. Here it is going to be stick the clamps inside the blood vessels. Therefore, it cannot flow within the blood vessels within the normal. These clamps of the skill cells block blood flow in the blood vessels. That lead to the limbs and organs. These blocked blood vessels may cause pain, infection, and as a result, the organ is going to be damaged. In skill cell anemia, lower than normal number of RBC occur. Why? Because these RBC cells, which is considered to be abnormal, which is have the skill cells, do not last very long. The lifespan مالتها is going to be decreased. Sometimes it is going to be decreased to 10 to 20 days. The body cannot reproduce adequate amount of RBC within the limited time. So the body cannot compensating losing of the RBC in order to replace the dying RBC. As a result, anemia. Then, if I want to summarize the causes, first of all, of the skill, the structures of the RBC is not going to be representing within normal. So, as a result, it's going to be representing within skill shape. This skill shape will affect the flowing of the blood, within affecting the flowing of the RBC within the blood vessels. And as a result, there will be clamping of these types of cell inside the blood vessels. This clamping is going to be affected the blood flow, and as a result, these types of cells is going to be die just within 10 to 20 days. Actually, our body do not compensating the losing of large amount of these types of cell within this is limited shorter time. اللايف سبان مالتها راح يقل. البادي ما يقدر يعطي adequate amount in order to compensate. وبالتالي anemia is going to be initiating. Diagnosis of iron deficiency anemia. نرجع على الدايجنوزيس بصورة عامة. Complete blood picture, complete blood cell, blood film. Here we could demonstrating that if the patient is complaining from microcytic hypochromic anemia, mostly occur بالiron deficiency anemia. Normal level are generally between 36-47% of adult and 40 to 50% of the adult men. Also, the age may affect the level of the hemoglobin. Serotonin, what we mean exactly by serotonin, it is considered to protein help store inside the iron body. Low level of the serotonin indicated low level of the stored iron. Total iron binding capacity is the blood test to see if there is too much or too little iron in the blood. Iron moves through the blood attached to a protein called transferrin. In addition, the normal value of the serum iron test إذن عندي iron, عندي total iron binding capacity, serotonin, and the complete blood picture. These are the most common laboratory tests which are used in order to confirm whether the patient is complaining from iron deficiency anemia or not. Other investigation which is required. تكلمنا عن iron deficiency anemia, تكلمنا عن السكيل cell pernicious anemia, and the plastic anemia, and what are the causes, what are and thalassemia, and what are the causes of these types of anemia. حقيقة طبيب الأسنان يحتاج أيضا إلى البليدنج تايم. هو medical test simple in order to assess the platelet function. It may give me indication the timing which is required by the blood in order to stop bleeding. So any affecting of the bleeding time may give me indication that the platelet function does not work with it correctly. Sometimes vascular disorder, like for example the von Willebrand disease, the hemophilia, may affect it or may prolong the bleeding time. In addition to the thrombocytopenia, disseminated intravascular coagulation, glandular thrombocythemia, and another disease like, for example, the Bernard-Toller disease. If we are going to investigating those types of patients, we could see that those types of patients are taking aspirin, cyclooxygenase, which is going to be affected the bleeding time. I want to say that the bleeding time, it is mostly affected by or reflecting, or is going to be reflecting the action of the platelet. Bleeding time له علاقة بالplatelet. إذن any vascular disorder, any coagulation factors is going to be affected. Any hematological disease اللي هي الهيموفيليا, الثرومبوسايتوبينيا, whatever, it is going to be affecting the bleeding time. هو simple test. So we, for those types of patients who have any family history of a bleeding disorder. Another test which is required, we call it the partial thromboplastin time or activated partial thromboplastin time. Even this types of patient is used for blood coagulation. Reference range مالته من 30 إلى 50. Even it is going to be used for those types of patient who is taking anticoagulant heparin. For example, patient with a hemophilia. لاحظ علاقة الهيموفيليا بالبليدنج تايم وعلاقتها أيضا بالactivated partial thromboplastin time. And any family history of a bleeding disorder, also species coagulation factor consumptions, sometimes the presence of antibody against the coagulation factor, and we could demonstrating these factors, which is responsible factor 8, factor 9, factor 11, 12, are rarely causes van Willebrand disease also may lead to prolonged partial thromboplastin time or activated partial thromboplastin time وعلاقتها بالfactors which is responsible about the coagulation, and sometimes the presence of antibody against the coagulation factor. يعني الفactor موجود لكن antibody is going to be representing that and specify in a patient with autoimmune diseases. ESR بالنسبة لنا ESR or erythrocyte centimeter rate بالحقيقة it is no Western centimeter rate, it is not considered to be specific, and sometimes it may associate it with autoimmune disease, for example arthritis, vasculitis, inflammatory, and it may associate it with the following. It may associate it with the following condition: headache, fever, loss of weight, anemia, and so on. مثل ما قلنا, it is not considered to be as specific because sometimes it may associate it with just an infection or inflammation, or sometimes it may associate it with autoimmune disease, rheumatoid arthritis. But sometimes the ESR also may reflect a serious condition because there are many types of cancers which may associate it with increase in the level of the ESR. ESR ما تعتبر specific بالنسبة لنا because infection with inflammation with autoimmune with cancer, all of them may lead to increase in the level of the ESR. نحب نوضح sometimes the ESR it's going to be increased and sometimes it is going to be slower than normal, which is going to be indicated a blood disorder, polycythemia, sickle cell anemia, leukocytosis, an abnormal increase in the white BCA. This is what we mean by leukocytosis. يعني whether it is going to be increased, whether it's going to be decreased, يعني whenever there was abnormal range of the ESR, it does not necessarily mean that the patient have a medical problem, but as a general talking, we have to refer the patient for further investigation or the physician in order to know the exact cause. يعني قد تكون أنت السبب اللي ممكن أن يعني we are going to send the patient for further investigation ونعرف what are the causes. Sometimes it's going to be indicated pregnancy, menstruation, or anemia also. Another test which is required by the dentist is INR. What we mean by INR test, international normalized ratio. INR test measure how long it takes for the blood to clot. Primary used to diagnose unusual bleeding. طبعا هذا التست يكون مهم جدا. Specify for those types of patient who is taking anticoagulant in the warfarin. When we are going to send when the patient is taking warfarin, we have to send the patient for INR because the liver function test may lead to a decrease in the production of certain clotting factors. And those types of patients may complain from أيضا البيشنت اللي أبو DVT, deep venous thrombosis, pulmonary emboli, atrial fibrillation, heart failure, whatever it is, all of it is going to be affected the mechanical types of INR. What we mean by INR test, it is going to be given in number وبالحقيقة نسبة ratio the test sample prothrombin time protein made by the liver at the time it's made to clot the blood. Then هو is going to be referred to that type of a protein which is going to be made by the liver. The prothrombin time of normal sample of the blood. Result مالته واحد ونص, it is considered to be normal, while when the level of the INR it is going to be decreased, or low INR means the blood is not thin enough or coagulate too easily, and the patient may have a risk to develop a blood clot. While in the myostatin INR, this may give us indication that the blood coagulates too slowly. And then the level of the coagulation of the blood is going to be affected by the INR. بعدين خلصنا الهيماتولوجيكال انفستيجيشن واللي تعتبر مهمة كلش إلنا. بعدين سوينا investigation to different types of anemia, السكيل سيل anemia والايرون deficiency anemia والبلاستيك anemia، وتعرفنا على البليدنج تايم وتعرفنا على البروثرومبين تايم والاكتيفيتد بارشال ثرومبوبلاستين تايم. الآن نحاول نأتي إلى موضوع آخر اللي هو البايوبسي. إخوان لما تتخرج إن شاء الله تأخذ شهادتك. Please, during examination of any oral mucosal lesion, during the intraoral examination, whenever you are going to see any ulcer, either white ulcer, red ulcer, when you are going to see any ulcer which does not respond to any type of a treatment, when you are going to see that this ulcer is going to be increased in size, associated with lymph node involvement, associated with bleeding, associated with odor, please send the patient for a specialist in order to investigating that. Send the patient for biopsy in order to investigate the exact histological characteristic features of this ulcer, because sometimes it is going to be considered as a serious condition. Please do not ignore any oral ulcer inside the oral cavity. Gold standard بالdiagnosis هو biopsy اللي هي بيس مال التشو ناخذها من البيشنت including وياها little bit of normal tissue, sent for the pathologist. The pathologist is going to use the microscope in order to see the histological changes. هذه الهيستولوجيكال أو الهيستوباثولوجيكال changes تكون أتيبيا، مجرد أتيبيا، قد تكون ديسبليجيا، قد تكون poorly differentiated، moderate differentiated، قد تكون serious condition like for example squamous cell carcinoma or any other types of carcinoma. Please do not ignore any ulcerative area. رح نتعرف في هذه المحاضرة ونكمل على different types مال البايوبسي سواء كانت excisional, incisional, fine needle or whatever. بالفاين نيدل aspiration هنا نسميه بالسيتولوجي. السيتولوجي هو superficial part is going to be investigating. هو exfoliative epithelial cell is going to be investigating. When we are going to use a thin needle inserted inside the suspicious area and syringe sometimes is going to be used. Now we are going to draw fluid in the cells for the analysis. وتعطيني بصورة سريعة لكن could I depend on the cytology in order to make a diagnosis? No, we cannot exclude it. The cancer when I'm going to use a fine needle aspiration because it is representing the superficial types of cells. It does not give me indication about the wide thickness of the epithelial cell. When we are going to use this in a patient with salivary gland enlargement, like for example the pleomorphic adenoma, another type of test which is going to be used what we call the core needle biopsy. Here, large needle tap is used during the core needle biopsy to draw a column of tissue out of the suspicious area. And the sample هنا يكون أكثر من الفاين needle ومور accurate يعني more accurate. It is going to be preserve the agriculture of the tissue. It does not cause damage to the tissue. It does not cause change in agricultures. And here we are going to investigating also under the microscope. is used when the incisional biopsy is inaccessible. في حالة laryngeal tumor, exfoliative cytology, which is examination of the cells سكرات مثل ما قلنا superficial type of cells. And quick and easy. Could we exclude it? No, we could not exclude it oral cancer unless we are going to make a biopsy, unless we are going to investigating the wild thickness of the epithelial cells. Here it is going to use the acantholytic cells of the pemphigus during the examination. Frozen section مثل هكذا حالة أثناء surgical operation. They are usually take a piece of tissue. This piece of tissue should be fresh and quickly frozen to about ناقص 70 degrees centigrade by liquid nitrogen or sometimes dry ice. Then after that they are going to investigating whether it is considered to be as a benign or a malignant. And we are going to give the result directly to the surgeon. Asna is going to making the surgical operation and he is going to make a correct decision whether total excision of the tissue should be removed or not. Also, freezing artifact can destroy the cellular picture. Sometimes a definite diagnosis can be impossible. إذا هذا الفروزن سكشن أثناء السيرجيكال أوبريشن تأخذ قسم من التشيو تندز إلى المختبر تفحص وترجع النتيجة في نفس الوقت. الإميونوفلورسنت مثل ما قلنا تكلمنا عليه بالمحاضرات والسيمينارات السابقة يستخدم بالنسبة للبامفيكس فولجاريس الميوكوس ممبرين. And here we could demonstrating autoantibody bound to the epithelial brachial cells. إذا هناك desmosomes cells. These desmosome cells is sometimes loose and led to the acantholytic types of lesions, like for example the pemphigus vulgaris or bullous pemphigus or mucous membrane pemphigoid. بعد أن خلصنا cytology والبيوبسي والاميونوفلورسنت موجودة بالمحاضرات الصور مال الاميونوفلورسنت كيف يبين different types of pemphigus. نتكلم عن الاكس راي conventional radiology, sometimes periapical bite wing or OPG for example. ممكن استخدام ال CT or computed tomography and this may use in a dense bone, and dense bone is usually represented as a white, soft tissue is represented as a mild gray, fat is going to be represented as a dark gray, and air is black. The most important thing is that the dental filling may cause artifact. راح نشوف بالسيمينارات استخدام الكمبيوتر توموغرافي واستخدام المagnetic resonance imaging MRI for the soft tissue, and sometimes we are going to use a biological test or molecular test, chromosomal study, comparative genome hybridization, DNA microarray, gene map, PCR, polymerase chain reaction. All of this considered to be as a molecular test, which is used for the diagnosis also. Actually, these types of tests need a specialist who is immunologist or is dealing with this substance, or what we call it the chromosomal studies or chromosomal analysis. You'd add the cytogenetic in order to see whether there is any lesion of the chromosome, any abnormalities, any dislocation of the chromosomes, and so on. If we want to know the exact infection causes, we have to send the patient for the culture and the sensitivity test. Here, if the patient is complaining from swelling of the soft tissue of the salivary gland, for example, or if the patient is complaining from jaw abscess, before we are going to prescribing any types of antibiotic, because sometimes this antibiotic does not affect it directly on the causative microorganisms. Here, we are going to isolating the specifically species or strain of the bacteria, and we are going to use different types of antibiotic. And we could see the specific antibiotic which is having inhibiting. يعني في مثل هذا inhibiting on the growth of this microorganism. في مثل هذه الحالة إذا عندي مثلا فد abscess، عندي هناك فد swelling، وأريد أعرف which type of antibiotic is highly specific، قبل ما أوصف هناك الأنتيبيوتيك بصورة عامة راح آخذ جزء وأزرعه هناك على ميديا معينة، وأسوي different type، وأعطي هناك different types of antibiotic أخليها، واشوف الزون مال الانهبيشن التي تتولد داير ما داير هذا المايكرو اورجانيزم، واعرف this microorganism is specifically sensitive to this types of antibiotic, therefore I'm going to prescribing this type of antibiotic specifically. تدعى بالمايكروبيولوجيكال تيست antibiotic sensitivity test. Here I mentioned detection of the infection, detection of the specific type of antibiotic which is required for these types of bacteria. يعني أعرف الsensitivity mostly used in the case of pus inside the salivary gland. And immunological tests are required by the oral medicine. It is mostly used in order to investigating the autoimmune diseases. Here, the dentist he have to know exactly which type of test which is required for every autoimmune disease. And here we have to know the specificity, the sensitivity of each type of test. Like, for example, the immunoglobulins, rheumatoid factors, the human-leukocyte antigen group of antigen located on chromosome 6. This is mostly used, as we are going to see, in a patient with a Behçet disease, for example. Antinuclear antibody, the anti-double strand of the DNA, and the anti-RO, SSA and SSB, which is highly specific for the Sjogren disease, which is going to be affected the salivary gland and other glands also. Then طبيب الأسنان يعرف which type of test he have to be recommended for each autoimmune diseases. Which type of test is highly specific. مثلا for example البهجت ال HLA-B51 يكون highly specific بالنسبة له. جوجرن ال SSA وال SSB يكون highly specific، وهكذا. Other types of test: detection of the candida. Candida infection is mostly occur on the oral cavity when the immunocompromised patient, and even in a normal patient sometimes we could describe different type, whether acute pseudomembranous candidiasis, or sometimes the candida is going to be superimposed of the pre-existing type of lesion on the white lesion. And here we could detect a direct smear from the area. We are going to use a PAS, product acid shift, or gram stain. We could demonstrating the presence of the typical hyphae. This may indicate that the candida proliferating inside the oral cavity. Here we are going to use a sterilized swab, wrapped and rotated vigorously over the oral mucosa, and try to get a deeply seated microorganism. Then we are going to use a specific types of candida, a specific type of media. This type of media is called sabroid, dextrose agar, and we need to add some antibiotic to prevent the growth of other types of bacteria. بدي نحصل على growth واحد أو نحصل على identify or colony of the candida. Sometimes we are going to add some antibiotic to this media, and we are going to identify the candida according to the morphology, size, moist, creamy, and yeast-like order. Whitish colony or cottony colonies may be used. Another type of test, the virus test. Virology, either we are going to isolating of the virus, or we are going to have a titer of antibody in the patient serum. That's what we call it, the virology. نعيد بصورة مختصرة. تكلمنا في هذه المحاضرات عن hematological investigation والتي نعتبرها جدا مهمة. تكلمنا عن ال different types of anemia. تكلمنا عن الساين والسيمتومز مال الانيميا. تكلمنا عن الوايت بي سي الار بي سي. وتكلمنا عن another investigation which is required for the dentist, including the cytology, the biopsy, also the detection of the candida, and the antibiotic sensitivity test, which is required in case of there is abscess representing. اقراها بصورة تفصيلية. المطلوب من عندك when we are going to use each specific of test for each condition. Again, we are ready to answer any types of a question. We are ready to answer for anything which is needing to be clarified. Please do not hesitate to contact us at any time in order to clarify the things for you in the oral medicine. Thank you a lot for listening.